Hola, queridos. Thank you for joining me for another episode of Latinas Who Lead. I am so honored to be joined by Dr. Cherise Rohr-Allegrini. She is a scientist, an epidemiologist, and a public health advocate. Thank you so much, Cherise, for talking with me today.
Thank you for having me.
So I have been following you online and am completely fascinated with your work and your expertise in diseases, and you as a community leader throughout this whole pandemic. So I want to know more about you, and I really want to know, how did you become an epidemiologist?
All right, so to start from the beginning, I was a political science major in college, and because I wanted to be a diplomat and travel, but mostly I was interested in learning about other people and understanding other cultures. And then I took biology classes and decided I loved biology, and I switched into biology. And then after 4 years, I wanted to graduate. And I had to do a year of physics, or I could do 2 poli-sci courses. So I switched back to poli-sci so I could just graduate. But I wasn't sure what I wanted to do. I wanted to do something in the health field. And I didn't want to be a physician. I knew that. I had been working in a public health clinic, and I thought public health was just care for disadvantaged people or poor people, people in poverty without health insurance. And I didn't realize there was more to public health. And so I was in my college's career center. This was back before we had Google or the internet. And I found books on epidemiology, and it was like lightning went off. It was perfect because it's this combination of science and understanding the science of a disease, how it works in the body, but also it's understanding community. It's understanding how people live and interact and communicate, because that also can affect disease transmission. And so I applied to public health school and got in and took it from there.
I want to point out that you have a pretty, this sounds so cliche, you have a very impressive education career. You went to UC Santa Barbara, Notre Dame, Yale. You don't just get there by accident. So was it your family who encouraged you to go to go to college? Tell me about what that was like. How did you get to that part of your education?
Yeah, so like we were talking before, my father had a dream of going to college and never could. And education was discouraged in his own family, and he saw it as this ticket out, this ticket to a better life. And he finished high school but was not able to go to college, and so it's something he always instilled in us kids. There's 8 of us. And he said, go to college so you can have choices, not necessarily to make more money. It was so that you have choices in what you do to earn your living. And he didn't really understand what that looked like, but he really encouraged it. And my mom as well. My mom's from a very traditional environment where she wasn't expected to go to college, but she did value education. And so even though they couldn't afford to send me to college, they helped me along the way to get there, to make sure I'd gone to good schools and did well and had a lot of support. And I have older siblings who had gone to college. And so I'm not the first in my family, but I'm part of the first generation to go to college. I was fortunate to have older siblings that had done it. So my sister in particular, she's 9 years older than me, but she struggled to get to college and stay in college, and she had to work really hard for it. And then she went to medical school. So by the time I was in college, she was in medical school, and she had gone to Cornell. So, and she always says I was a diversity admission to Cornell, but so what? And
the degree's the same.
Exactly. She said, I don't care. I got in, and let me do what I'm going to do. And I kind of felt the same way when I was looking at graduate schools. I wanted to go somewhere different too. I'd grown up in California. Santa Barbara is absolutely the most beautiful place on earth, but I wanted to try a new life. And so I looked at schools on the East Coast, and Yale was one of them that had a program that was really interesting to me. And I think in part because I had a sister at Cornell already, I felt like it wasn't out of reach.
Mm.
And so, I mean, financially it was, I was paying for it till I was 40, but, but I, you know, academically, I like it, my grades were good. They weren't fabulous, but they were good. But I worked really hard in my GRE and I got some really good recommendations. And I'm fairly sure I was a diversity admit as well, but I don't care. Like, if that's what's going to get my foot in the door, I will take it, because then I can do, I mean, I've had this amazing life since then. And had I hesitated, or had I been too proud to accept that handout as it was, I mean, I worked really hard for it, but I'm sure listing me as a Latina was good for their diversity classifications. But
Oh
that's
yeah.
okay.
Yeah.
You know, like, fine, then I can be a model for other people, and I'm going to make the most of it. And that's kind of what I've done.
I definitely hear you on that. I think I know that that is a common internal struggle for a lot of Latinas. This is called Latinas Who Lead. What is your definition or idea of leadership? And has that adjusted or changed at all throughout this pandemic?
I don't think it's changed. I think my understanding of leadership has evolved over the years, for certainly, but and certainly as you get older, you have a different perspective. But I see leadership as inspiration. It's not telling people what to do. It's not a boss or a manager. A leader is somebody who inspires others to do great things, and brings them up, and finds the unique things that other people have that they can put forth. So I've often said, you know, I do care a little bit that you credit me with ideas, but also if you're going to do the things that I'm suggesting, I'm just happy you're doing them.
Mm-hmm.
I would like a little bit of recognition, but it's okay if I don't have it. You know, it's because what I want is to make sure that the right things are being done. So I feel like leadership it's being willing to put yourself out there, which also means that you can be the subject of attacks once you put yourself out there. But it's recognizing the strengths in other people. And we have so many incredible people in San Antonio working on this, that we need to boost them up and say, okay, this is where you're doing a great job, or this is your skill set. Let's make the most of it. And sometimes somebody's best skills are not that obvious, or doesn't fit their job description. And so it's being able to find, you know, something that they do best, and bringing that up and making the most of it, even if it's not their job title.
Have you had experience, did someone do that for you, or have you had experience getting to do that for someone else?
I would say that's kind of, I don't know that somebody's did it for me as much as I just stepped into that all my life. But, you know, when I was Department of Safe Health Services, Region 8 Communicable Disease Manager. And part of that was emergency response. And while I was doing that, we had a number of outbreaks, and we had the last pandemic during that time, and various other things. Often people would be assigned duties based on their job title. And what I did instead was I went through not just our staff, but former staff and people I knew in the community, and said, tell me your skills. What's your skill set? I'm going to make a spreadsheet that has your name and all the different things you could do. So it could be they're a nurse, but they like to sew. Or, you know, little things that you never know what's going to be useful in an emergency response, because there's so many different things you need to call upon. So making that spreadsheet, I love spreadsheets. That's part of it.
Of course, you're a scientist.
But being able to put that together, so when my directors would say, okay, we need people to fill these roles, I don't have to look at their job title. I can look at their skill set, which means, okay, that person can fulfill this role, and then I can get someone else to take over their job, because we have another person that could do that job, but nobody else that could do that particular skill. And so I did that a lot during pretty much every outbreak or every response that we needed. And it gives people a chance to shine. It really gives them a chance to say, you know, just to do what they're really good at and be acknowledged for it. And I think that's important. And to me, that's a really important part of leadership.
What is the most important thing or most pressing thing you need the public to know about COVID-19?
First, the most pressing thing to know about COVID-19 is it's still out there. It's going to be out there for a very long time. This isn't going to end soon. When I say out there, I mean it's infecting people. It's not hanging around the air. You can go outside and you're not going to get infected unless you're close to somebody. But what I really want to say is continue to listen to the scientists and the public health professionals. And even though their guidance might change over time, that's because the science is evolving and we learn new things. So it's okay that it changes. Listen to the most recent thing and use that as your guide. Make sure that the people you're listening to are the experts that you can trust. And don't expect it to don't expect to go back to where we were 6 months ago tomorrow. It's going to be a long time before we're in that state.
A lot of this audience that will be watching and listening to this are Latina moms. So some insight on how you make sure that your culture is being passed down to your kids.
So this is a very, very important thing for me because I grew up with a German father and a Mexican mother in a Mexican community. So the Mexican part of my culture was kind of everyday life. My German family, we didn't see very often. They lived in another state. So my mom, the Mexican in my family, made a point to make sure that we understood German culture as much as possible. Now it was sort of her impression of German culture, so it was like going to the Oktoberfest. But that was really important to her, and I appreciated that. And my father even learned a lot more about German culture after, because my father's the fourth generation. So growing up like that was very important to me. That said, I didn't speak Spanish growing up. I still don't, my Spanish is terrible right now, and it's really an unfortunate thing. And even my mother didn't speak Spanish growing up because her parents said, you're in America, you speak English. And to them, speaking Spanish was a sign of, they were incredibly prejudiced. So it's, those people spoke Spanish. We're here. They were trying to fit into society, and they stopped my mother from speaking Spanish. So she learned along the way, but it wasn't, in my home, we didn't speak Spanish. In my community, everybody I knew spoke Spanish. All of my friends' parents spoke Spanish. So I learned a little bit growing up, but not very well. And so being in San Antonio, that's a critical thing for me. So my kids are in a dual language program at school. They have been since kinder, where they're learning Spanish and English. And as part of that program, they learn a lot about Hispanic culture in general. And their teachers come from different countries, so it's not just Mexican culture. There's a lot of different elements that they get. And that multiculturalism is so essential for me. I mean, that's kind of what prompted me to go into epidemiology anyway. Remember, I said I wanted to travel and learn about other communities. Yeah. And so I think it's important for my kids to understand that background. They're also half Swiss. So my husband's from Switzerland. And that's a really important part of who they are as well. So understanding that culture is something that we infuse on a daily basis. And so there's a lot of different ways to share who we are. I sometimes have to remind my kids that you're Mexican too. My son looks just like me. He looks very, 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 very Mexican. My daughter looks like my husband. She's very fair, and so I have to kind of remind them that you are. They love it though. It's like, well, that's actually really cool because it's not obvious all the time. But they like to embrace those the cultural characteristics that they're learning about, and again, learning it as something of who they are, but also learning about other people and helping to understand more about cultures in general is just, I think that's a critical thing for me, and I'm kind of infusing that into my children.
I love it because it's beyond critical for you and your family, what you're passing down, but more and more today, being able to see other cultures and other people and just see them as different than you, but not more or less than, and being able to appreciate other people of all shades and all cultures and all backgrounds, I think really is the key to getting to where we want to be as a society.
I think so. I love our differences. I think they're fascinating. I don't want to see everybody as the same. I want to find out what makes you, how are you different from me? Because that's what's interesting to me.
Right.
If you're the same as me, that's boring.
We already know that story.
I just want to throw one more thing. So
Sure.
growing up, I said I was half German, half Mexican. Where I grew up, that was very rare. That was, everybody was either Mexican or there's a few Anglo folks thrown in. But here, when I came to San Antonio, it's like everybody's half German and half Mexican. It was so fascinating. It's actually really common. So I felt even more like, wow, I found my people.
Well, thank you so much. I appreciate it. I hope you have a wonderful and safe weekend.
Well, thank you, and you too. And I'm really glad we got to kind of meet in person.
Absolutely. When it's safe, we will meet in real life.
Yes, I'm looking forward to that.
Awesome.
All right.
Thank you,
Take care.
Cherise.
Thank you, Melanie. Bye-bye.
Bye-bye.
Bye-bye.